Hello, welcome to this video on OET listening. Now in this video we'll be practicing some part B questions. What kind of audios do you listen in part B of listening? Of course, they are conversations that happen in a healthcare setting, workplace settings. Okay. So what type of questions you need to answer, that also we have seen through different videos. You will be listening to the audio and you have to answer multiple choice questions with 3 different options. Now in total in part B of OET listening, you will have 6 questions, each question having 3 different options, and these 6 questions are independent of one another, meaning to say that there's no continuity between the questions in part B. Unlike part A and part C, there is no continuity. Okay. Now through this video, what we are specifically trying to see is that how certain verbs or certain words in the question will help you in identifying the right answer. Of course, multiple choice questions are quite challenging. Now, why is it challenging is because you are given different options. It's not like that you are given a blank space and listen to the audio and identify the answer as per what you listen in the audio. In that case, I think things would have been much easier. But here, when you're given different options which are more or less same, then you find it difficult to pick which one. So that is the challenge here. Now if you have a wide range of options, how can we narrow down to one specific option? That is by reading the question carefully. Many a times what I've noticed students doing is that they would, when they get time to analyze the question in part B, before each question, that is before the audio relating to that question begins, you have 15 seconds to analyze the question. Now during that 15 seconds, students will take out time and go through the options again and again. They'll be underlining the keywords in the options. Of course, they are necessary, but primarily what you need to do is you have to understand what the question demands. Accordingly, you will be able to narrow down to one specific answer. Because if you don't understand what the question is and simply focus on the options, then that would just be a futile attempt. Okay. So through this video, let's identify the importance of understanding the key words or the verbs in the question and how they will help in identifying the right answer. So for the first question, let's do that in a detailed way. And then in total, I have 4 questions. For the first question, let's do that in a detailed way. And then for the remaining 3 questions, I'll be practicing it along with you. And then after that, we'll have the discussion. So let's begin. Here you can see on screen the first question. It says that you hear an optometrist talking to a patient who is trying contact lenses for the first time. So you understand the setting. Now, and what is the question? Sometimes students underline the setting. Of course, understanding the setting is necessary so that you can prepare accordingly. But more importantly, focus on what the question is. Here, this is just the background that is mentioned. The background information is given. Okay, you understand that. You hear an optometrist talking to a patient who's trying contact lenses for the first time. And what is the question? What are we supposed to find out? Don't first go through the options. Okay, they'll be underlining blurred vision, then soreness, then how to remove the lenses. This is what students generally do. First, try and understand what is the question looking for. What is the question really looking for? What is the patient concerned about? So this is the key verb or the key word here. What is the patient concerned about? Now you need to understand that when it comes to the listening test, specifically for multiple choice questions, you'll hear the reference to all the words in all the options in the audio. Now, how can we filter out the incorrect options? By knowing what the question wants. Here the question wants to know what is the concern of the patient. Now, what do you mean by concern? Concern means worry. What is the patient worried about? Now, his blurred version, is it about his blurred version, or is it about the soreness in his eye after using the contact lens for the first time? Or is it that he doesn't know or he's not very okay with how to remove the lenses? Now, one more thing that you need to understand is that when you have words like this, concern, related to emotion, concern, you should not be expecting the word as such or the synonym of that word as such to be mentioned in the audio. From what is being said, you should be able to understand that it is a concern that they are expressing. For instance, suppose if blurred vision is a concern, then it's not necessary. What I'm trying to say is that it's not necessary that the patient should say that I have a concern regarding blurred vision or I'm worried about blurred vision. The patient can say that, see, my vision is blurred, my vision seems to be blurred, I'm not able to read anything properly. Then that shows the concern. What I try to say is that it need not be very explicitly mentioned, that feeling or emotion need not be explicitly mentioned in the audio. Then soreness in his eyes. If it is about soreness, like the patient can say that my eyes seem to be sore. That is a concern. Then how to remove the lenses. Is it necessary, or should you be expecting that I'm worried about removing the contact lenses? No. The patient can also say that I'm not quite okay. I don't find removing the contact lenses very okay, or I'm not really confident with removing the contact lenses. That is again a concern. So understanding the actual meaning of this word is necessary. It's not just enough that you look out for synonyms. Maybe sometimes even synonyms might not appear in the audio. You have to understand what is the actual meaning behind that word, and keep that in mind, and then listen to the audio. So first understand the key word in the question, what is the right meaning of that, then underline the key words in the question as well by the time the audio starts. Okay, now let's play the audio.
Now look at question 25. You hear an optometrist talking to a patient who's trying contact lenses for the first time. Now read the question.
Now, you've had the lenses in for a few minutes. How are they feeling?
Not bad. I thought I'd feel them actually touching my eyes, that they'd be sore or prickly, but I can't feel much at all. My eyes do feel a bit watery though.
It's okay. You've just used too much solution. Now, in a few minutes, I'll get you to try taking them out and inserting them again by yourself.
I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard.
That's unlikely to happen.
Things look rather distorted though. I mean, I can't make out the letters on that chart.
Any of them?
Those lower down.
Let's give things another minute to settle down.
Okay. Now, how did it go? Were you able to identify the right answer? See, two of the options we were able to easily eliminate, and even though this blurred vision, option B got eliminated and option C got eliminated, I can show you the transcript and tell you how it is. Some of you would have already identified it. If not, you may please go through the transcript as well. Now, how option B got eliminated? Because here the patient is saying, optometrist is asking after putting the contact lens, trying the contact lens for the first time, how does it feel? So the patient says, not bad. I thought I'd feel them actually touching my eyes. I thought they would be sore or prickly, but I can't feel much at all. So which means that he didn't have this concern of soreness. So you have to watch out for such words in the audio, but. They already mentioned soreness, sore. Then they are contradicting the idea, but. I felt there would be soreness. I thought they would be sore or prickly, but. But means you have to expect a reverse of idea. I can't feel much at all, which means that immediately you should be crossing out that option. Then moving on to option C, how that got eliminated. Then the optometrist is asking about like, I'll get you to try taking them out and inserting them again by yourself. For that, what is the patient replying? The patient says that I had no trouble taking them out earlier, which means that he has no problem with the removal of lenses. So that is not his concern. But I'm confident about putting them, but I'm not confident about putting them in. Actually, so one of his worries is that he's not confident about putting them in. But do we have an option matching that? Here it is very clear, specifically mentioned that about the removal of lenses. But regarding that, what is mentioned in the audio, he has no problem regarding the removal of lenses, but he is not confident with putting them back. But that option is not there, so we cannot choose this one. This is obviously wrong because he's okay with that. Then the one which we are left out with is option A. So A has to be the right answer. And how do we get it? So the patient says that things look rather distorted. Distorted means the vision is blurred. Even if you're not able to identify the meaning of what distorted is, you should be able to understand that A is the right answer because that is the only option that we are left with. Now, we were able to eliminate option B and C. Only if you listen carefully, if you had understood the question carefully, and if you had carefully listened to the audio, you would be able to do so. Okay, so I hope this is clear. Now we shall try another example.
Question 29. You hear part of a surgical team's briefing. Now read the question.
OK, next is Mr. Malloy's repeat laparotomy. Any anaesthesia issues?
We don't expect any particular problems. He's relatively fit and well, except for his epilepsy, which is under good control. His BMI is 35.
But will we need the obesity bed?
It shouldn't be an issue.
And what about the epilepsy post-operative management?
He's taking his oral medications and we can use an IV if necessary.
I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. He's certainly at the extremely low edge in terms of pain threshold.
Okay, now what about this one? In this case also, like before we landed on to the right answer, we were able to eliminate the incorrect options. How many of you could do that? See, here what is the question demanding, or what does the question want to know? The male surgeon suggests that the patient could. Now, what do you mean by suggestion? Suggestion means putting forward something for consideration. That is what you mean by suggest that. Suggest. So, and here it is very specifically mentioned, male surgeon. So, you have to look out for what is being said by the male voice. Now, what is that male surgeon putting forward as suggestion? Now, how can you understand a suggestion? If the person says that you can do this or this may be required, then it is a suggestion. So, you have to understand whether the male surgeon suggests the need for any specialist equipment during surgery. Some special equipment is needed for surgery, or is the surgeon saying that the patient might benefit from a specific anesthetic procedure? Is the surgeon saying that a specific or a special anesthetic procedure is being mentioned by the surgeon that would benefit the patient, or is the surgeon suggesting that there can be a risk of complication for the patient because of another health issue? Okay, these were the options. Now I'll show you the transcript. First, this option got eliminated. That is option C, the risk of complications from another health issue. How that got eliminated? If you look through the transcript, you can see the male surgeon is asking, next is Mr. Malloy's repeat laparotomy, any anesthesia issues? And for that, the female voice replies like, we don't expect any particular problems. He's relatively fit and well, except for his epilepsy. So that is another health issue that they are talking about, which is under good control, which means that now that is under control and there will not be any possible risk or complications associated with that. So immediately you will be crossing out this. That is why it is very important that you read every word in the option as well. Okay. So another health issue which they have hinted here is regarding this epilepsy, but the nurse says that it is under good control, which means that this will not be, they have not mentioned any complication associated with that another health issue. So that is eliminated. Then the next we got option A eliminated, the requirement for a specialist equipment during surgery. Now what was that? The surgeon is asking, will we need the obesity bed? Then the nurse replies that it shouldn't be an issue, which means that there's no need of an obesity bed. His BMI is 35. The nurse says that his BMI is 35. Then the surgeon is asking, will there be a need of this obesity bed? That is this specialist equipment that they are talking about during surgery. Will he need that obesity bed? But the nurse says that it shouldn't be a problem, which means that for that also there is no suggestion being said. Then what is this male voice saying? This, what you can see highlighted in blue are the voices of this male surgeon. Now the transcript associated with the male surgeon. Now for this, the last part, what is the surgeon saying? I know he was in a lot of discomfort after his last surgery, and this time he's going to need a larger midline incision. It may be worth thinking about an epidural. It may be worth thinking about. That is, he's putting forward a consideration. It will be good, or it may be good if you can take into account, if you can think, may be worth thinking. That is what you mean by suggest. Okay, and that is the question, what it wants to find out. What does this male surgeon suggest? So the male surgeon says that it may be worth if you can think of it. I'm giving you a suggestion if I say that, why don't you think that? Or why don't you consider that? That's what suggestion means. Same way here the male nurse is saying that it may be worth thinking about an epidural. An epidural is a specific anesthetic procedure, which means that option B is the right answer. Now shall we move on to our next question.
Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Now let's analyze this. What is the question here? What does she warn her colleague about? Now what do you mean by warn? Warning somebody? As I said for the first question, it need not be explicitly said like, I warn you. No, it need not be necessary that the word warn should come. But warning somebody means telling the person to be cautious about something. Okay, being cautious. So regarding what aspect, the nurse is telling her colleague to be cautious. Now when you say cautious, if I say somebody that the floor is slippery. Now when I see a child running, I say that, hey, that floor is slippery, which means I'm giving a warning. He might fall. Right. Now, like regarding this first option, allergic, if I say that, you see the patient is allergic to peanuts or so and so, or this specific medication. Now when you say that, you're giving a warning there. Now in that way, what warning is being heard in the audio, that is what we have to find out. Now here we were able to, I'll show you the transcript. So it says that this nurse is briefing out to her colleague, and she says that Mrs. Green was admitted last night for pneumonia. She came in yesterday with cough, fever, dizziness and chest comfort. She's a healthy 60-year-old lady with a history of right knee, all those things. And then she says that she's on regular diet. Yes, she's on regular diet. Yeah, and has no allergies. And here the warning talks about the allergies. Is allergic to some types of antibiotics, but very clearly in the audio you hear that she has no allergies. Immediately cross out this option. Then what's the next thing? She is at high risk for falls due to her dizziness. High risk for falls. If you are telling the colleague that, see, she's at high risk for falls, there's a high possibility for the patient to have a fall, which means that is a warning. You are alerting your colleague to be careful or mindful regarding that aspect of the patient. Because of this dizziness, there is high chance that the patient might fall. So you should be careful regarding that. That is the warning. And for that reason, care must be taken to prevent the patient from falling. That is the answer. Now let's put that on hold. Let's see whether we are hearing anything regarding the option C as well. Now regarding that, you hear the nurse saying her vital signs are stable, oxygen saturation is 98% on 1 liter, and she's been comfortable during my shift, which means that there are no signs of any complication being mentioned during the briefing. Now this option, as per option C, what does it say? Oxygen may be needed if the patient becomes breathless, but nothing, you cannot hear any such reference. As per the nurse, like during her shift, the patient was comfortable, her oxygen saturation level was 98%, and there is no such warning being given that if there is a possibility of complication, then oxygen need to be administered. No. For that reason, we can eliminate this as well, and definitely we can conclude on the option B as the right answer. So by now, I hope you have got an idea on how you need to focus on the right words in the question, by which you will be able to land on the right answer. Okay? Now, keep doing your practice with multiple choice questions, specifically part B and part C, and see how it works applying the same technique. Okay? Hope you found this technique helpful, and I believe that you would be applying the same next time when you do your listening practice. Happy learning and stay tuned until we meet next time. Thank you.
Medcity International Academy. Trusted hands forever.